is pale, cool, and dry. Okay.
Yep.
Burns to the hands on kids are serious, right? So law enforcement is on scene, caregivers holding the patient. Patient is squirming and attempting to escape. Visible burn to the patient's entire left hand, and the burn ends at level above the wrist. What are you thinking?
What happened?
Okay, did you get into something?
Dipped it in water.
Okay. Seriously though, we said
Yeah,
that brain
we
reacts
watched
in
that too.
milliseconds. Do you think it would go all the way to his wrist?
No, I think that sensor, the thing you said would go quicker. Probably on your
Fingertips usually, right? And their hand is out. So that makes me think, right?
Unless they fell into it.
Okay, unless they fell into it.
But why the Strider?
Well, that's like.
Maybe because he's crying so hard, trying to escape.
Yeah, and the caregiver's holding the patient and that kid don't wanna be with him. That's,
Yeah.
I think
Maybe
abuse.
a caregiver did it.
That's what,
That's what
yes,
I think.
that's what I
abuse.
think.
She's crying because she abused them.
And, yeah, you'd be
All right.
comforted if you were.
So-
That was my first thought, yes.
No extenuating hemorrhage noted, potable stridor. And stridor is an indicator for what? Upper airway stuff, upper airway obstruction.
Yeah.
Okay,
Chemical burn.
Maybe he has
maybe.
burns in his throat, something hot was poured down his throat too.
Okay. He's breathing 32 times a minute, clear breath sounds bilaterally. So 2-year-old, 32 breaths a minute. It's a little high, but not much, right? Rapid pulse rate. Skin is cool, pale, and dry. He's got a GCS of 10. The burn to the left hand is red in color, wet in appearance, and ending at a level above the wrist. Caregiver has an ice pack applied to the burned hand and the child is shivering. So, ice to the pack to that burn, is that a good idea for a second-degree burn?
Nope.
Okay? Ice pack to that hand, right? As soon as we damage our skin, we lose the ability to do what? Feel and control temperature, right? Our skin helps control temperature. So people with burns, you think, oh my God, they're burnt, they're hot, but they're actually freezing because they can't regulate. Now you add an ice pack to that, he's gonna.
Stop the burn, so the bullseye radius doesn't expand.
Not a second degree.
So just higher than that? Or
Second degree, you want no ice pack to it.
told us we had to stop the burn, no matter what, with liquid. For sure.
Liquid, not ice.
Okay. So not nice, but you would just run under cold water? If, like, room
Tepid,
temperature water?
tepid water.
Because the heat that it's, like, even that water is gonna be cooler than what's doing the burn.
Right.
So it's gonna stop the burn.
Got it. That's helpful, because they didn't really explain that, like desensitization.
So
with-
how common are burns in pediatric patients?
Fairly common.
Fairly common, right? Fairly common. Which type of burns are the most common?
Second.
First.
Usually it's first or second degree burns, right? Kids are exploring, right? We get up next to the pot on the stove, and they hit the handle, right? Those types of things happen. Cups of coffee, right? Kids are under feet, walking with your coffee. Oops! Right. What would lead you to suspect this was an intentional caused burn injury?
Well, all the things you've said.
Location. of the
Location.
burn.
The amount.
Location, how that,
Up to
you
the
know,
wrist.
his whole hand is.
Get away from the
He's trying to
caregiver.
escape.
Some of us are older in here, but did your mom ever tell you you were gonna be in hot water? If you did something?
It still does.
I was up shit creek without that.
You were up shit creek? We were in hot water,
Yep.
right?
I still
You were in hot water and I was getting spanking.
You're gonna be in hot water when your dad gets home.
Oh my god, I'll be
Okay? That saying actually came from a punishment they used to do in Europe, which was they would take the baby and they would set them butt in the hot water, and that was punishment for them. That was hot. You were in hot water.
Well, it didn't actually ever happen, she just said it. Thank God.
So, when we look at burns, we look at, you know, we call them first degree, second degree, third degree, but really technically we would call them superficial, partial thickness, and full thickness burns. Okay? Superficials like that sunburn, right? That's a superficial burn. Partial thickness is going to go through the epidermis, the top layer, down into the subcutaneous area. Generally with that, you're going to see blistering, red. Full thickness is going to go all the way through the layers of the skin to the nerves and muscle. And a lot of times those full thickness burns are either white and waxy or black.
Fun fact, third degree burns don't hurt. It's the second degree burns around them that hurt. What? There's no nerves, so there's no nerve endings in a third degree burn, so that doesn't hurt, but it's the,
There's no nerve endings? You don't think that?
well, they're burned.
It burned them.
Yeah.
So it burns the parts of them, but there's still a part where the burn hasn't gone all the way through, right? Our nerves
I
don't.
was told they don't hurt.
Oh, no,
because
they
it's
hurt.
the second degree burns around them that are hurting.
I had a 16-year-old girl who was raking leaves and burning them. She had a huge pile of leaves and they weren't burning the way she wanted, so she grabbed the gas can and poured it on them, and the fire came up into the gas can. The gas can exploded. She had third-degree burns from her fingertips to her arm, to her shoulders. Her shirt and bra actually melted to her. And so she had severe burns there to there. Nothing in her mid, but her shorts and underwear burned completely and melted to her. She was screaming in pain.
I believe that, yeah.
I'd be
So third-degree burn.
What'd you give her for pain?
Every ounce of morphine that I had with me, and I paralyzed her and sedated her and intubated her.
Hey, where's the closest burn center?
Regions Burn Center in Minneapolis.
We're just in competition all the time.
Yeah. I won't tell you what you just said under your breath.
What?
That's right, bitch. I will tell you after.
But where will you be sleeping tonight?
My bad.
So what's unique anatomic and physiologic characters of this patient that are concerned? So if the entire hand was burned, we call that a circumferential burn, right? What do we worry about when we have a circumferential burn?
The tightening, or like.
The swelling and the tightening and everything becomes compressed, and there's nowhere for that to go out So it starts to squeeze in. And when it squeezes in, it's gonna start cutting off all the blood supply to that extremity, to that hand. And when you think about their airway, what is different about a child's airway compared to ours as an adult?
Smaller.
Smaller airway, larger tongue, right? So they have more chance of an upper airway issue, even just with their tongue, right? Pediatric patients in shock. Kids compensate really well until they can't compensate anymore, right? So they will look fine. They look great. They look great. Their pulse is elevated. Their respiratory rate's elevated. Their blood pressure's normal-ish. And then all of a sudden, they drop off the cliff. Blood pressure plummets, pulse plummets, respiratory rate plummets. Okay? We need to be prepared for that. We have to know that they do really well until they can't do well anymore. And that's, we need to step in and intervene early. Blood pressure is a poor indicator of shock in a child. Okay? Because they do compensate that well. All right, secondary survey, heart rate is 132, O2 sats are 98%, respiratory rate's 20, blood pressure is 64 over 32. What's normal blood pressure for a 2-year-old? So we take 90 times 2 times years in age. So 94 would be normal for this child systolic. 64. What's that tell you?
Not great.
He's not doing great.
And the temperature's low, so that can be an indicator of shock too.
All right, no bleeding. We should intubate or think about that supraglottic airway before it gets too late, because that stridor means there's closing up. And if we don't be aggressive, we'll be at that point where we can't ventilate them. Okay? 100% humidified oxygen via BVM. Elevate the burned extremity. No disability. Patient, make sure there are no other burns. Stop the burning process if still present. Is advanced airway management indicated for this patient? It is because of the stridor, right? What physical assessment finding indicates potential respiratory compromise? The stridor. Based on what we know about the patient, what are our management options? How are we going to manage the burn? Dry dressing. Okay, dry dressing wrapped, right? Elevated. Treat him for shock, right? Keep him laying down, keep him warm. I mean, we saw his temperature earlier was 95.6, right? We gotta get him warmed up before he starts using all his energy to warm himself up.
How are you gonna get him to lay down, is my question, if he's trying to get away from the caregiver. I don't know that I I mean, obviously. we
So if it
restrain-
was done on purpose, maybe coming to you, he's gonna settle down.
Yeah, I don't know.
I
I wouldn't.
I have a question about airways and these burn victims, whether they're kids or adults.
Okay,
So how quickly do you, cause I know you said you can get that swelling can happen pretty quickly. Okay, so the only thing we could possibly get in somebody while they're, you know, kinda with it is a nasal. How much time are you gonna have if that swelling is starting? Are you, if they finally start to become unresponsive, are you going straight to the cane then?
straight to the king.
Okay, but are you gonna be able with the swelling, you know, you have to inflate the ball.
Hopefully we can get past the swelling, hopefully that swelling's in the larynx, or the oropharynx back there, and we can get back past that into the larynx.
Cause I just feel like 1 minute they're sitting there like talking to you and screaming, crying, whatever, and then that swelling is happening and you're gonna start to hear it, but you can't really do anything until they're not coherent.
Yep. It's that fine line, right? It's watching them,
And waiting for
and
that.
then do it as quick as you can.
That's where an eye gel would be beneficial
What's,
in that circumstance,
why?
because it'd be quicker. There's undeniable that it'd be quicker.
It could be quicker.
Definitely.
Have you guys ever had to do that?
But I would think the crew would have the right size king lube
Yeah.
ready to go.
Yep, yeah, we definitely prepared, right? You have that stuff prepared.
And our burn guy that went out on the fixed wing at Carrington, cause I had to drive to get us out of there, the paramedic that got in the back, did he intubate in the back of the rig?
Yes.
Because I remembered hearing the gentleman very vocal, he was in a lot of pain. So did he sedated him then? As soon as your paramedic shows up, they sedate him?
Yep.
Okay. That was my, like, we don't have the ability to sedate somebody to do that airway in a nice amount of time.
Yep,
Or is
it's
it
hard.
like-
Have you guys had to like use a king tube in a ped patient?
Oh my gosh, no.
No, okay. So like if we ever had to, it kind of be like the first time in a real life scenario.
First time for everything. So what percentage of body area has been burned?
So for example, you should like use their hand, like as,
The rule of palms,
yeah.
okay?
Patience palm.
Patient's palm, right? Okay. It's hotter.
If you gotta go, I get it, we're fine.
What assessment methods, we talked about rule of palms. How much on that hand? When we talk about a child, an arm is what? What percentage?
On a child, isn't it 18?
It's 18. 9 for the upper arm, 9 for the lower arm. So if we're talking about hand, what percentage would that be? About 4.5%, 4%, right? Okay. What are the initial actions the pre-hospital care provider should take when managing that burn injury? Well, we kind of talked about that, right? Stopping the burn.
So we would do that in the rig, like we would pour tepid water in a basin of some
Yep.
sort and soak the hand in it.
Not for long, just enough to, stop some of that burning,
Yeah, but,
and then dry. Are you thinking you would do it longer?
well, I know how, if you burn your finger, like you run it under water and the second you pull it out, like it still hurts. So I would think that would, like, a quick little rinse wouldn't help him, right or wrong?
Well, so think about it. How long is it gonna take you to get there? To the scene. 10 minutes
At least.
at least. So that's 10 minutes, hopefully that it's been out of water. So it should start doing that on its own. So, you know, a quick minute
You mean
or
at the
two.
house, you're thinking, I'm not following you.
On our bad burn that we had, they had used an actual cotton bed sheet and wet that bed sheet and just covered him with it. So our guy was like pretty damp, and they told us that was the wrong thing to do because he couldn't regulate his body temperature
Right.
by the time, you know, we didn't keep that bed sheet on him. We got rid of it as soon as we loaded. Didn't we?
Well, I think I recall them using wet dressings in the back of that ambulance.
I was in the front, so I didn't see all the.
Because I thought Carrington said you did the right thing, like you had to stop that burn. He was burning garbage too and dumped a chemical in and,
Was it where his clothes burnt on it? Like what happens in the case of like your clothes? Because I know Harvey had a situation.
Don't peel it off.
You just leave it on there.
You leave it on there.
And then, like it wouldn't, if you're in coveralls and they're, or do you remember that?
You cut whatever you can off, but don't peel.
Oh, yeah. I mean,
So as they heal, isn't
But
that
how
what
do you-
that debridement is? When
Yep.
they scrape that
Yeah, but
after?
do you still like, that's just their cover? I mean, you just still keep them warm, like you don't.
So you put a dry, sterile sheet on them and then cover them with a blanket.
I have
So
one
we got
question.
burn sheets.
Like a little more recently, like a couple years ago, you guys have had that PEDS kid that like burned, I don't know, tea or something, I don't remember. So in that situation, what did you guys do? Was it like kind of stopped by the time you got there, or did you pour water on it? I don't know who went, but.
No,
we picked him up in a motor vehicle, met him
yeah,
en route, and the
Oh.
paramedic from Harvey put some kind of medicated dressing on, remember?
So you guys like didn't have to do like initials, you.
I ended up being, I ended up being kind of halfway in the front on that, running the radio on that call, so I didn't see a lot of
I just remember that the paramedic said something to us about ordering some medicated dressings, remember that? And I ordered what she told me to order, and then I think it was Marjorie said, you never use that on a burn.
I wonder if it wasn't medicated, but it was like that Vaseline, like on one side.
Something, it had
Yeah.
something
So
on it.
there are Vaseline gauze pads,
I think that,
but Vaseline keeps the heat in.
right,
You don't want to put that on.
cause this baby had dumped it, was it from here down?
Yeah,
Chest, right?
yeah, kind of like down the side of the face, neck, chest.
And they actually flew him to the burn center, but then they let it, like, it was fine.
Yeah,
Like,
I don't even think he stayed.
when they called the burn center from Harvey, the burn center got him and went, yeah, no, he can go home.
Mhm.
It was weird.
His parents didn't even get, they had to wait for his parents to get there to take him home.
Mhm.
There was a lag, yeah, they were like ready to.
Which is
release him.
good, but I just remember, we had always been told dry dressing, always
Dry dressing.
Mhm.
But then like Jordan, when they went to conference, like, we were never taught
Mhm.
to like stop the burn, you know, cool, it was always don't put anything on the burn.
Yeah, and that's why I say just quick in the water, because the longer you do it, the colder they're gonna get.
Okay.
In this situation on here though, when you get there, it's already over, 'cause she has an ice pack on her hand, right? It's just.
Yeah.
Yeah, at that point, the burn should be stopped, or the burning should be stopped, right?
So when I worked at Rosa's, and you got burned by that oven all the time, Mimi always teaches you to keep your hand next to the oven,
I
right after.
got it.
Oh my.
And I'm like, you're crazy, it's hot.
That tells you to keep your burn
Yes,
hand.
every time she burns herself, she will put her finger next to the oven.
Oh my lord.
And I'm like, what the hell is wrong with you?
She likes to cool down slow.
I don't know.
But I used to not have feeling of my fingers. Like I could touch hot pans when I worked
Oh,
in the
yeah, that
kitchen,
was her
you
too,
know?
but-
Yeah, like because you just lost all the nerve.
I don't know. She just always says, if you guys ever get burned, make sure you put it right next to the oven. Like,
Yeah, pretty sure no.
no, thank you. I'm gonna go to the sink and
All right.
run cold water.
So, How should we, yeah, we did that. Should we ever pop blisters?
No.
No. I'm not gonna talk about that. I'm not gonna talk about that.
Just tell us what happened to the poor thing.
Okay. Secondary survey performed during transport, no additional injuries noted. Patient is transported by ambulance to a designated burn center. Patient is discharged home following several successful skin grafts. The incident was reported to Child Protective Services for follow-up. Pediatric assessment to identify potential life threats, determine the best method to manage the patient, and reassess airway and burns after management's completed. That was our critical actions. So,
So are you thinking that was a hot water burn then?
yep. Probably dipped a hand into a pan of water or something. It's, people do weird things in the name of discipline.
Yeah, yeah.
They really do. All right, we're on the last slides.
Are you sure you don't need to hit the road home?
No,
Because
we're
if-
fine.
Okay.
That's fine. All right, so we have to remember the golden principles, right? And we need to focus on principles rather than preferences. So what does that mean? We kind of talked about it that last time I was here. We may have a preference on how we want to do things, but is that preference the right thing to be doing, or is it the principle that's the right thing to be doing? It's the principle, right? It's the principle that's the right way to do it. We need to make sure that we have communication with our receiving facility, right? Always to let them know what's going on, what's coming in, right? Okay? And always remember, we don't want to do any further harm. That's our goal. We don't want to do any further harm. So we have to make sure safety, right? Our safety, we teach everybody scene safety, our safety, patient safety, crew safety, right? Right away. Doing our scene assessment, doing our primary survey, doing our secondary survey, remembering our Platinum 10, right? Trying to limit our time on scene to 10 minutes or less to keep within our golden hour. The golden hour is what? From the time it happens till they get definitive care, right? Okay. We need to make sure that we're using good principles for triage decisions, for the need for specialized care, identify comorbid conditions, right? When you think about need for specialized care, right? We think about, okay, that burn patient that we have. What would be the need of specialized care there? A burn center, right? Okay? You think about comorbid conditions. That would be our patient that, geez, he cut himself and he takes Coumadin for AFib. What's that mean to us? It means we're gonna have a heck of a time stopping that bleed. I remember going to a guy who was in his 70s and cut himself shaving, taking Coumadin, and he bled and bled and bled. Didn't matter what I did, direct pressure, you know, it's here, right? You can't do anything other than pressure. It was the hardest thing to stop because of that. Okay? So remember those comorbid things that we are taking care of our patients. And then remember, pediatric, those pregnant ladies and elderly are all gonna be a little bit different from our normal adult patients. How do we reduce trauma deaths and disabilities? How do we do it? How do we reduce the morbidity and mortality of our trauma patients? Training. We're keeping our skills up. That's how we do it, right? And then prevention. That's your job, Jordan. Right? You try, right? I mean, that's what you do with county health, right? Kind of, I'm assuming. Prevention. See? I was right. Okay, so prevention, and then just keeping our skills up. And so next week when we get together, we're gonna practice all those skills. We're gonna practice that binder. We're gonna practice boarding and sea collaring. We're gonna practice, packing a wound and putting tourniquets on and all those things that come along with trauma. Okay? And this just tells you a little bit about continuing education programs through NAEMT, which PHDLS is part of. So we've accepted the responsibility that we must give up to our patients the very best care that we can. What have you done today for the good of mankind? That was Dr. McSwain, who has written a lot of textbooks, recently passed away. They kind of called him one of the big gurus of pre-hospital care. Questions? Concerns? Problems?
This is such a good refresher, I appreciate it a lot.
Next week. So I know we had talked about, I gave Dawn my one day I had this week, and I said I'm available Tuesday, Wednesday next week. I know we planned Wednesday.
Do we for sure have a track meet?
As of right
As
now.
of now, there's possibility that it won't happen because of the conditions out there, but as of
Depends
right
on
now-
the weather.
Yes.
Like everything else in life.
Yes.
Yeah, I'm sure we won't get a call till
Yeah, Monday.
Uh-huh.
Yeah.
Am I hoping? No, absolutely.
My phone says 51 and partly cloudy on
Yeah.
Tuesday of next week.
Well,
Today.
it's-
It depends on if it snows and
it's
rains.
so wet
It's
back
flooded out there.
Yeah,
Yeah.
that's,
And the ditch, what did he say about in that meeting? That the ditch doesn't clear out, so they can't
No,
pump
the
anything
bridge
to
is
the
flooding.
ditch.
The
Yeah.
bridge is flooding, so.
One problem.
I thought we
I
had decided on Wednesday.
think,
Okay.
We did.
I think, yeah, Wednesday.
All of us are probably,
Mhm.
the three of us at the school are gonna be required to get that track meet, I'm sure, so.
Either way.
that's what-
If you haven't signed up, you sure can.
I haven't signed up yet, but I'm sure they'll put me wherever.
If you show up, you will have a spot.
All right, so